Hello, and welcome to Dr. B Talks About Nasal Obstruction with me, Dr. John Burgoyne, a practicing otolaryngologist with over 30 years experience in treating nose problems. I'm in the Austin area, and I'm happy to be with you today. Today we're going to talk about nasal obstruction, and we're going to talk about these main reasons why people's noses are blocked. Crooked septums, enlarged turbinates, nasal polyps, collapse of the nasal valve, and enlarged adenoids. So we got quite a few things to cover, but we'll get there. So here's the nose. This is my lovely wife, actually. And if we look inside the nose, running down the middle of the nose, just this way, is what's called the nasal septum. It's cartilage or bone in the middle with lining tissue on the outside. If we look on the sides of the nose, we have these things sticking in from the sides of the nose, like this. These are called turbinates. And these are like shelves of tissue whose job is to warm and humidify the air. So this is the diagram of what a normal type nose looks like. But actually, it's not exactly this way, because these turbinates are coated with tissue that can expand and contract. And for most of us, for several hours at a time, one side will be relatively swollen, and then it'll switch around and the other side will be relatively swollen. The side where things are more swollen, you don't breathe as well through, but usually it's not a complete blockage, and so people don't notice it so much. So here we are. This is kind of the normal nose. The first thing we're going to talk about is what's called a septal deviation. So here is a septum that is not straight. That's a septal deviation. That's all it means. It just means a crooked septum. And obviously, if the septum is crooked, it's going to make it harder to breathe on the side that it's crooked towards. But what also always happens is the turbinate that's on the side that has more room will become enlarged as well, just because of the way the airflow causes it to get larger. And so somebody who has a deviated septum may have blockage on both sides. And in fact, in a lot of cases, the crooked septum will cause this turbinate to get so big that people have actually more trouble breathing on the side that is away from the septum. We see that quite a bit. Now, if you do a CAT scan, these septal deviations are sometimes real pointy. This is the crooked septum, but they're very obvious on CT scans. So that's the first thing we're going to talk about. The second thing I've already kind of alluded to, which are turbinate swelling. Swollen turbinates are called turbinate hypertrophy, and that can make it just so you can't get enough air through. And if that happens when you have a deviated septum, it even compounds the problem. These two often go together. The fact you have a crooked septum, the irregular airflow resulting from that stimulates the growth of these turbinates. Next thing we're going to talk about are nasal polyps. Nasal polyps are these swollen things inside the nose. They're not actually true growths. They're more like the lining tissue has swollen and is hanging down in globs, and they kind of look like this, kind of like a peeled grape with blood vessels. So those are polyps. And those can be just in the nose, although they're often in the sinuses. That's a different talk. But these can take up room and can block the breathing. Then the next thing we're going to talk about is what's called nasal valve collapse. So if this is the normal breathing, people who have nasal valve collapse, they try to breathe in, and their nostrils collapse like this, so they can't get enough air through. That's called nasal valve collapse. So far we've talked about septal deviation, turbinate hypertrophy, nasal polyps, and nasal valve collapse. The last one we're going to just mention is adenoid problems. In the back of the nose here, right here, there is tissue called adenoidal tissue. This is often large, especially in kids between the ages of about 2 and 6 or 8. And sometimes that'll get swollen enough that it'll block things. Something I want to point out is that sinus problems in and of themselves do not cause nasal obstruction. So this is a cross-section picture of the sinuses. you don't breathe through the sinuses, you breathe through the nose. So even if the sinuses are blocked or absent, that won't affect your breathing. Conversely, you can have breathing problems and not have any sinus problems. That being said, chronic sinus infections can lead to chronic turbinate swelling and can lead to polyps, and so then that can cause obstruction. So they can be related. But remember, the breathing part of it is not the sinuses. The breathing part of it is the nose. So what can be done about this? Well, first, we always want to look at non-surgical options. So if the turbinates are too big, we'd like to shrink them. And how do we do that? Well, the most useful way to do that without surgery is by use of nasal sprays that contain steroids. Common brands for this would be like Nasacort or Flonase or something like that. So that would help. Treating any infection will also help because infections cause those turbinates to become swollen. So we treat the infection. Treating allergies helps because allergies makes the turbinates swell. And as I say, the nasal steroid sprays are the most useful way to cause shrinkage of the turbinates due to allergies or chronic infections. So that's the main thing we can do to reduce the turbinate size. You can also treat the nasal collapse, nasal valve collapse, nasal collapse without surgery. One way is to use these little, they're called Breathe Right strips is the common brand, but you put them on the nose like this and they're sticky and then they spring open. And some people find this really helps. They make everybody breathe a little better, but these can be really helpful. You may have seen sometimes athletes use these to help them get more air during games. Another thing you can do, which sounds kind of crazy, is you can get these nasal cones and put them inside the nose. And that can also hold things open. Now, if you're not an NFL football star, you may not want to wear Breathe Right strips all day. But if your biggest problem is because you can't breathe very well at night, this or this may be the right thing to do. You can also treat polyps. Again, nasal steroid sprays will shrink polyps to some extent. Sometimes we have to use oral steroids because that's more powerful and that'll shrink them. I've had a lot of patients who have nasal polyps and periodically, maybe once a year or so, their polyps get too big and they give them a round of steroids. They shrink down and they just stay on their steroid sprays and they're good to go. We have some new drugs. These drugs are called biologic drugs and they are expensive and they have to be given by injection, but they can be very effective in shrinking polyps. So we always want to do things to treat things medically before we necessarily think about surgery. You may have noticed I didn't have any medical treatment for the crooked septum. That's just a crooked piece of cartilage. There's nothing you can do about that in and of itself. So if none of that works, then you consider surgery. And for nasal obstruction, surgery is usually highly effective. At least 95% of patients find that nasal surgery can make their breathing excellent. And it is typically long lasting. If you have a septal deviation, you can straighten the septum. If you have enlarged turbinates, you can reduce the turbinate size. If you have polyps, you can remove them. If you have nasal valve collapse, you can do an internal little splint with cartilage that'll keep the nasal valves more open. Also, if you have big adenoids, you can take them out, but that's, as I say, a thing mostly for young kids. All right, well, that's it. That's my little talk on the causes of nasal obstruction. I'm hoping that will give you a little bit more clarity on what your doctor may have told you about why you can't breathe through the nose. Remember, Dr. B talks about is not the practice of medicine itself. You're not going to get everything you need to know from a YouTube video, as good as it might be. So if you do have a problem with breathing through your nose, go see your doctor. If you're in the Austin area, feel free to look me up and come see me. I'm John Burgoyne, and this has been Dr. B Talks About Nasal Obstruction. If you've enjoyed this video, press like, share, and subscribe to the channel and check out our other videos that are in the series. Thank you.